Nanoma livele Eswatini njengalamanye amave emhlaba liphishanekile lilwa nemkhuhlane iCovid-19 kepha ke ligciwane leHIV it is still the country's biggest public health concern. Lusho ukuthi laseSwatini solo linensayeya yekulwa neligciwane leHIV nakulesikhathi semkhuhlane iCovid-19 ngakho ke litiko letempilo lisithi nasifika kulesikhathi lesi lendalisiqiniseko sekuthi eMaswati lawo ladzinga imithi noma ke amaphilisi ekuthintsibalisa lona leligciwane akasonzedwe dudane naso sive njengoba laseSwatini solo ke likiyo ke i-partial lockdown. Kanti ke lihlelo lelo lesekelwa nguhulumende ehlanganisini letempilo ngekubambisana na Dotinini Delive lifekhathi baka URC University Research Company. Kanti ke studio ngina Yvonne Makhwabalala. She's from Zimbabwe kepha ke usebenza khona ka URC based Lubombo region. Yvonne, good evening and welcome to the show.
Okay, thank you so much.
Are you good?
Yes, I'm okay.
Now, talk to me about the community art program that you are supporting the ministry to try to bring services closer to those who need them the most.
Okay, thank you so much. We are very excited and we are very happy. We would like to appreciate the government for Swaziland for letting this delivery service to the people whereby everyone is able to access medication, especially those who are having chronic conditions. Okay. Like for example, those who are taking ARVs, asthmatic drugs, hypertensive drugs, even diabetes. So as we know that COVID-19 has brought a lot of things in our lives that we were not expecting. For example, there was a lockdown whereby there were some restrictions in movement of clients. So some clients, they actually survive by taking this medication. Like for example, if you miss your dosage, it will actually affect your life. So what the government has done, they've looked upon it and they said, okay, let's try and bring these drugs closer to the people so that there is limited movement of clients from their homes to the facility. However, this was a very good move because it also prevents the transmission of COVID from one place to another, because now the patients are no longer traveling using the buses. You know, during traveling, as you get into the buses or combis, you meet different people and then COVID is also what transmitted. Yes, so this model of community distribution is done in all places in the country.
Okay.
However, clients are actually educated, and we also as healthcare workers, we explain why is it important for them to get their drugs closer to their homestead. But however, it is also voluntary. We do not force them, but we also explain to them because of their chronic conditions, they are at high risk of contracting COVID-19.
Okay. Now, when you are saying you are taking this medication closer to the people, where are you exactly taking them? Are you taking them to the nearest church, to the nearest whatever that is there? Maybe in Kunda's constituency center. Where exactly are you taking them to?
Okay, we have different clients and we have different people who stay in different areas. So what we are doing, we are selling this model to everyone. So once we get a number of clients that we know that they are residing in the same Tingundla or Mpakati, okay, we then arrange a day. And then we carry everything, the drugs, the chronic condition drugs, diabetic, ARVs, everything. We then go with the car to meet them. So we normally plan in advance so that they know that people from this clinic X are coming with our medication. So we also advise them to just come with their cards. Okay. And the nurses will be there, who will be having everyone from the facility to assist them with what they need, and everything is done, even the observations we do them, and we also observe the COVID-19 protocols so that social distancing is maintained as well. We also give them health education and also the importance of continue with their medication despite COVID-19.
So much has been done to maybe even teach us to be aware of HIV in the kingdom, but there's still the issue of stigma. Now, when we are bringing those services to the people on a certain day, it is only them, the clients, who will know on Tuesday the minister is coming with our medication, so that not everyone can be aware. So to try to avoid the issue of stigma, because I don't want to imagine a situation where I know you'll be coming on Tuesday, for example, then I'll see your truck coming and I'll be saying, oh, those are the HIV positive people, they are going to take their medication. Maybe some will be afraid to go and take their medication because of that.
Okay, thank you so much. I think, stigma is something that starts even with you inside before it is transmitted to another person. So what we are doing in terms of stigma, we are not specifically saying we are coming with ARVs. Okay. We are coming with different drugs for the clients that have got a chronic condition. Okay. Yes. So like, for example, if Clinic X is the clinic that is being used by these clients, then we call them, we ask if they are comfortable. And when we are advertising, we are not advertising for ARVs only, because we also want those who are diabetic to benefit from this commodity distribution, because it makes them, it brings the drugs, the access, it promotes the access. So these clients will be able to access their medication. So it's a plus for everyone. I would like to mention that, sometimes us in town, we think of stigma. But in the communities, bayakumukela in Eswatini, they feel very happy because, number one, they are saving their transport. Number two, they have got a chronic condition. And every day we are talking about the transmission of COVID-19. So it is better for me, as you want, to get medication maybe under the tree or near the church or near the preschool, rather than for me to be exposed to COVID-19. And also, maybe I do not have enough funds to sponsor myself to get into a bus to and from. So I think most people, they are actually happy with it, and most of them are actually saying we thank government for what they have started for us. Yeah. So for now, I think it's a good thing, and I can say even beyond COVID-19, it's actually a good thing that the government has started. I think it can actually continue, because this is not a new thing. We used to do outreaches whereby we were also trying to reach out clients to access the services.
Kasike bongosi njoba siteka indzaba nje na litiko letempilo lihlala ligcikitela njalo vele kuseni kulesikhathi se COVID-19 bantfu labane tifo letitsite kungaba boshukela kufune sibanakele kakhulu ngimsebenzikele ndiwalitiyo le ukuthi emaphilisi abo akasonzele tutane nabo bangatawuhamba mhlambe esigaba lesitse kuto watfola sebangakhanza ukuthi sebabutha nayona le COVID le. Now Yvonne, how do you monitor? Is there any mechanism that you use to monitor if client X has not come to receive their medication?
Yes, we do have even paper-based registers that we record for all our clients, and also the government has done a very wonderful thing. We now have electronic system where we are able to capture all our clients. For example, if Yvonne gets medication in Babane but resides in Lubombo, once you get into that system, it will actually appear that I have taken my medication in Babane clinic. Okay. So we do have a method of tracking these clients. So if there is any gap, we are supported to actually remind them through phone calls, if they are comfortable of home visits, we also do home visits. And we also maybe remind them that, okay, today we are coming to Mambani Mpakati. So everyone who is taking their medication, who is diabetic, who is hypertension, they can come so that they can access the services, because we will carry everything. And as we give out, we will also record in our registers.
Eswatini bongo silingu lamanye mave ase-Afrika lelibonakala liyinqoba ke impi yamalala eveva kanti ke libonakala lento umsebenzi lomuhle kakhulu enzabeni yayo i-HIV njengoba liyabashaya abo-90 labathathu liyaze ke lahlonishwa nangomhlaba kanti ke liyachubeka nekulwa netifo letifana nabo shukela lesekuthiwa ke silent killer khona eSwatini ofayikhathi naso sifo sesifuba sengathi TB. Yvonne, thank you so much for coming through. I want to bring in Dr. Advocate Dlamini, who will give us more insights kule ndzaba lesikhuluma ngayo bonke siyasase nje likhefu lelincane sitabuya ke sixoxisane na Dr. Advocate Dlamini.
Kudla kwempilo, food for life. An agricultural program that shows how a farmer brings food to the nation. Agribusiness, small farm business ranging from animal keeping, soil testing, planting and harvesting, livestock business, latest farming tools, and the success stories of local farmers that has succeeded in the farming business.
Sinekudla kwayo letawuphindze kudle nasekufika isikhathi sebusika. Kudla kusemhlabathini, konke lesikudingako sitakuthola emhlabathini.
Kuyaphileka. Uvame ukuthengisa leti letimvuna letilungela ukuthi setiyohlala.
Kudla kwempilo for agriculture and farming development on Eswatini TV with the farm boy Samgelo Vilarati Samvini. Kudla kwempilo, food for life.
Liverpool have been looking for a second. Oxlade-Chamberlain has got a run on goal. He's still going. And Salah for Liverpool! Have a little bit of that! And the roof comes off the famous...
With over 300 games in 6 weeks, get DSTV to watch the best live football action.
Maye umxoka akusilo liphutha ukuthi ulalele iFeminine Touch, uvula ingcomvo yakho, uvule inhlitiyo yakho, ungadehluleli, uvele utitshele ukuthi wena namuhla uyakhiwa, namuhla indlela takho tiyacondziswa kuze utoba ngiloko uNkulunkulu lakudelela ukuthi ube ngeke umhlaba angakasekelwa.
Phuma kuloko kushiwo abantu, forget about everything they're saying. Be you, do you, always.
As long as unako, as long as ujabulile, unako konke lokufunako wena, unelikhaya uvulala udlile uvuka udlile. Pelele buhle bukekhathi kuwe.
Not to say do not wear what you want to wear, but love yourself in the process. Be comfortable in the process. Dihloniphe in the process yokuthi mina ngimuhle.
Kuliqiniso ukuthi it upsets you. Nova nje umuntu athi you chama yosudla la. For a minute there uva nawe ngazothi hey. Yes. You now chama nontombi. For a minute, for a split second kuyakufikela vele lokho ukuthi yo okay, no, I'm not what they are saying I am.
Ni bangu 210,000 Maswati la phila neligciwane iHIV even laseSwatini. Kanti ke lehlelo lesikhuluma ngalo lekumikisa umuthi noma ke maphilisi thutane nesivi kakhulu kade labo labane chronic illnesses. Kuhlelo ke lelaqala vele khona enzabeni yeHIV awasonzetha uhulumende thutane nebantu labawadzingako. Sina Dr. Advocate Dlamini ke sitawujula kabandi kuyelenzaba ekumikiswa kwayo lemithi lena emakhaya. ngiteka yona mostokotela
uteka yona
it's not entirely a new system.
It's not akusiye isystem lenje njengoba sobekile Mr Mleleke ngokuthi le hlelo lobezivele sinalo ka HIV solibita nge-DSD differentiated system delivery ngokuthi sinike ehlobo sitho lebantu lebonakala ukuthi lidzinga kusitakala ngamaphilisi HIV kodwa ke ukhanze ukuthi kune-desire sithe lapha nalapha kahle kahle emtembeni bona baphila bacinzetele kahle HIV yabo i-viral load yabo ngube kusele fire cars bo driver bema truck ngube kusele abantu besikole laba abafunza kulama emakolleji la ngeGotrutan elivela kangwani ngephandle mukhanza ukuthi siyabaniketa vele bo 6 months ukuthi ete simpopole simkhanze konke kuhamba kahle simnikete 6 months wetinyanga ahamba esikolweni indlela yendawo nakangalenga sesikolweni ubese lokahlola dokotela ngenyanga dokotela luseJudan amhlole i-viral load ambone ukuthi kudeni imkhuhlane lemsonzelelayo abuye nale report sonke isikhathi nakabo kwasefika covid nakafika sathi nasemdadisha kwathiwa covid wonke umuntu lonesimo sithe emtembeni lonemkhuhlane laphila nawo ushukela iBP umdlavuza base ngotini ngokuthi emasotsha abakagcini nakafika covid angabaniketa umkhuhlane lomathima ngoba covid yakuniketa sigaba sokuba symptomatic akunikete mild akunikete severe even critical kwathiwa ke abaphephiswe laba bantu abakhweshiswe la esiqumbini sebantakhumbula esibhedlela kodwa wonke umuntu bantu ngedoba bashela ukuthi namhlavukela esibhedlela noma ngavukela lo nyulimele lo bagcine basicumbile esibhedlela kwathiwa abakhweshela esibhedlela sibafikele babe ngasekhaya siseke nakufika lo mthetho wezathi sicaba sitha njani ukuze siyakhumbula ukuthi kodwa sinalo hlelo lesinalo ka-HIV luyasisita kubantu sayesitala nje umfana walolu ngokuthi ibide ngena nge-CDD community distribution of HIV commodities TB shukela and in high safaya khasi sasengeta ne TB luhlobo lolwengetekile lokuthola amaphilisi e-TB sibita nge-TPT sengeta ne-family planning ekhasi ngokuthi bantu nabo lokubaletha esibhedlela lokhanza sibakutela nyanga yakhumbula omaye ukuthi phela khona labahlela imndeni labeta njalo esibhedlela batothola umjovo noma amaphilisi sathi ngoba laba vele bavamse kuba icembu leliphilayo emthimbeni isikhathi lesinyeni litela nje kuto refill sathi abakhoshi babe ngasekhaya sineke simixa lamaphilisi lekibo lokumixa lamaphilisi sisebenzisa a very simple modality kwecala ngobekusele bantu ikhona lento ukuthi emaphilisi bawathatha noma ngula abafuna khona there is freedom because lokho kulungelo labo ukhona lo mkhanze ukuthi ngwasenhlangano amaphilisi HIV wasathatha la number 1 so ngalo ukuthi kunalesigaba ukuthi usengademukele ngokuthi embangona kubatiwe ngokuthi udle amaphilisi HIV so uya noma nguphi yakhumbula nje nasicala mebeze baphumela ivila kangwane bakelenye live ngephandle nasicala because kwakusana lenkinga yale stigma so nyalo ke bantu bekusokhona nalo so sacela ukuthi emaswati lawo lasakhonayo ukuthi sekafika esigabeni sokumukela awathathe lamaphilisi ngasekhaya sasibhedlela letinkulu njengembabano nakungenteka kunebantu basemochane laba sasimaphilisi embabane esibhedlela esikhulu abaye emochane clinic basezulwini kunezulwini clinic Skangeni kunesigangeni clinic basase khona nakona lapha eclinic saniketa emandla eclinic ukuthi ayibuke lo ukuthi abantu bangaphiki igcwala la clinic nanginetinzawo letinye sibita ngabogogo center ema preschool nanani aba extend kwentela ukuthi abantu kusondeluleki ubathu wasasa lukhona ke hlobo lonye lencisha lentafisa ukukhuluma ukuthi lolu loselungasekele bangatemukeli bona ukuthi bafune kubonakala sinabo database
okay
ngokuthi sinako database ukuthi kuna advocate lamini ngwasezulwini vele kuyamehlula ke clinic ezulwini so ngaziyafuna lokuthola lokuhle lokuthi sisebenta netinini tenkosi we call them implementing partners le ngekusita hulumende litiko letempilo bale mimangweni hoho ubukwen ekpaf
okay
manzini ubukwen ICAP lubombo ubukwen URC la kunabo yuvon khona bese kuthi shiselwe nohlukene ekhasi lenye portion ibukwen ekpaf lenye ibukwen MSF so bale imimangweni vele ubona ukuthi imoto tabotibhaliwe njalo njalo ihamba lemangweni ngetinhlelo tiyacinisa la litiko letempilo lisabhekwele tiyacinisa la so nanyalo basebenta bafike basebakusasana lokho kwaba ngeke bagijima lemangweni lona lo sedesibinzi sokuthi asho ukuthi ngithatheni anginiketeni la bamshayela icini base advocate silazulwini sikubona ngawo uphi mina kethu ngoba langa lokho selifike asike advocate hayi ngimele madoda lapha ngasesipa engiyeda nje masine basithi ke phatha bhukwana wakho nakafika sivula icomputer sibuke bhukwana wakhe sibuke ukuthi kuhamba kahle sireconcile inombolo tethu simbhalise simnikete emapresident ngedwe sisho ukuthi udle kahle ke mina kethu ube ngasekhaya uphephe covid nakhona lokuncintayo uyasinza emoyeni sina inombolo esisebenzisa kulohlelo lo ithi 1212 ushaya inombolo ya MTN kwanyalo ilandline nasozi mobile besengamsebenzisi kwanyalo but itawulunga masinyana ushaya 1212 usho ukuthi omning advocate ngadla mina bekulanga lami namhla lokuthi ngithole amaphilisi mana ngatholi angathi nento enjani madoda that ngosiyami siyaxolisa ungakuphi asibonane utothola ngale kwaloko sisizabalele bese ukuthi ke etiko letempilo la ngekhasi ikhona indlela yokulandzela lo hlelo sinemhlangano ngabo lesibili fortnightly letintengo the implementing partners letilema ngente report
ukuthi kuhamba njani
basho ukuthi mina ngekuphafu kulenyanga lena ngibone etigulane leti ngiyabekisa 3500 letilingana leti nombolo vele letikhona tibantu labadla amaphilisi HIV vele kusethe lo lahlekile akusahamba kahle bonke bakhona asho na ICAP kamanzini asho na MSF asho na EPAF kanjalo sakanje bekusethe lo sesinikete inkinga nekuthi ke nasicela kusebenta sibuke tingongweni te takhumbula ukuthi live la kangwane emaphilisi alwakhi lona siwasanga ngephandle ukhumbula ukuthi lo COVID ulokho wonke mfu nasifika kubo lockdown sonke silokhile ukuda kuphuma indiza kuphuma istimela kuvaliwe indlela lenhle ukuthi litiko la procurement kahulumende etiko letempilo lisebenza CMS vele tingunta ubatlanzelela ukuthi bacolela kuba nesitoko lesithasemalanga lamazi nokuthi bebebethe basheshe bamemetele ukuthi hey sine nje etiko letempilo kaSnap unasikhuluma ngeARVs sihlale sinembiko every week we call it stock status ukuthi kanjani emaphilisi sente ukuthi sisheshe siphakamise alarm ukuthi hey bonkosi lo sengakathenga singaze sibe netinkinga so ukhanze ukuthi tingungu tiyazivumela ukuthi abantu bangathola tingaleti insathu kushiyaneke ka HIV nje ebantwaneni bebasathola tinyanga letimbili ka TB bebasathola tinyanga letimbili abanye bathola tinyanga letinsathu ngekushiyashiyana kuye ngokuthi tingungu tethu tisivumela kuthini kwanyalo so bese kuthi labo lokhanze kubekisele kashukela nje kulamalanga kashukela naka BP kulamalanga basathola inyanga yinye akhona nje amaphilisi litawungena kulamalanga level walungisile khona emavile ubona ukuthi cha edinkinga singathenga vele kuyatoka ukuthi lokuyasetshenziswa so siyakhona ukuthenga atawungena so emaswata ngethuke ukuthi ngoba sine sine COVID sine lockdown mhlawumbe amaphilisi atawuphela cha sibukile sebenta kona se office buka kona
la uvakasha lapha before lehlelo leli advocate na uvakasha ngisathi noma ngilesibili noma ngilesine lapha kashukwela bomangala abantu labadzala lapha noma ungafika ngabo 2 ekseni ubakhanza labanye vele balala khona ingabe ke laba kashukela umlo mdzala nje lekhaya longasakhona mhlambe kuthi hambele but now unalo shukela ngiyakhona mina ukuthi ngathi ukuthi nikhona namhla ngithathe liphepha la gogo ngimlanzelela amaphilisi noma ngifuna futhi sithwale gogo ngalibhala noma niyakhona yini ekusuka niyathi usilapha kagule kunagogo bani ninteni imleselela amaphilisi
inhlanhla lenhle kunayo lekhona ukuthi kule mkhuhlane leba semthimbeni kahle chronic illnesses sisina sikucala kube khona lomunye lesicela ukuthi ahambe nawo lo hambo we call them treatment support sho ukuthi nasibhalisa nje la ekhasi imniningwane kuba ligama lakho nogula kube nesikhala salomunye lotawuhamba nawo lempilo treatment yakwesekela so kangawo benasho sekunenkinga kuwe nalona siyamconsider ukuthi sibambisana bokho nje angisho ukuthi inkosi yami nako lokho bekuyinsaye besayibuka sithiwe ukuthi lelo khanze ukuthi bafike kuseni kangaka ngosihamba toba imalayini ngoba la malayini abamanzi kodwa ngalesikhathi se-COVID la malayini kude ngoba bangasekhaya lolu hlelo sijabulela ngaloko ukuthi ihlobo tethu etitaba nalendlela ukuthi tivukele lo kathi esibedlela nyalo batawuthola abale ngasekhaya siyalanzelela kakhulu letincingo siyatishaya siyatama ukuthi silanzelele sive kusibanjani siphinde sigcizelele ukuthi kulowo noma ngawe yadla ngalendlela lefansedla ngakhona but uyeva ukuthi khona lesokumncinta empilweni akekho emtholampilo soyisebenta ayikavalwa sibedlela ngenzaba ukuthi une COVID selo esivuleke isibedlela siyasebenta kodwa ke vele laba ema chronic illnesses sise abebe ngasekhaya yes sithinzana nabo lalo 121 na 977 ukhona 977 wethu angakafi COVID beka nemaline lalishumi 10 lines beyasebenza nje tinzaba ukuthi kuyaphuthuma lapha na kwanza COVID we expanded to 25 lines endele yokuthi nyelo satisfy COVID ekhaya kusho ukuthi nawo shanje ungena 977 uyashaya usho ukuthi mine ngikuphi ngisibanibani bengicela kusitakala nganahlobo nalo sito ngicela emaphilisi la ngasekhaya lapha ka 977 kune team lesiyakhiwa to be fab goals kunema consultant angakhona bese kufaka ngakhona athi naba laba baka CDD bakhuluma ngabo bacela ukukhuluma nayo setamile ukuhlanganisa dingaba khona ikhalo ngoba ikhalo ngoba phela uyasitshela kodwa nje setamile nemaswati siwavile lokunye lesibentayo khona la lenintengosi sendaqwana ngoluhamba la ngemuva we are checking the impact of COVID to our services kubantu bethu labanemkhuhlane labagulela emakhaya so masinyane sitabe sithola ukuthi how was the impact eTikotembilo how was the impact of COVID kulendlela ekusebenta kwethu so stabisa umbiwo sibona ukuthi isala la siqinisela phana lapho
kasi ke bongosi National Development Strategy yalo live beyikuvedile nalo ukuthi vele uhulumende uyawulusenza lusito tutane nebantu i-decentralization ngifuna lokuthola la advocate because stamlanza lokukhulumela abantu labashika kakhulu ngala ka HIV futhi show ngisitawubana nabo ukuthi balemukela kanjani lohlelo leli ukuthi yebi COVID vele tene mathuba lamaningi sayitaba indlela yokusebenza ile noma kutawuthi athi gozolo lo COVID etlisemandla sibuyele nje wabe sisebenza
kukhona igama loshidole lemnazi ukuthi COVID utekto kusibangela ukuthi sikhona kusebenza ngetindlela ezithile ngicabanga ukuthi lo hlelo lo sitawukhuluma nalabazali believe ukuthi imane ichubekele impilo ngoba inalokuhle kwayo yabo uma vele singekho lesidingo sekusube sesibedlela masukuda thole amaphilisi akho ngaleyo ndlela ube ngasekhaya nasingekho lesidingo labo la kufuna babone ngudokotela they always batawukhe emapoint ukuthi wena siyacela ukuthi ube khona ngesuku lokuthide kodwa nje lo luntu lonyende sitacela ukuthi baba ngasebenteka ngoba le inzaba lemgcoka ukuthi we want to decongest lesibedlela sifuna lokuthi sehlise nombolo debantu laba esibedlela sikhase sinye yabo so akusiko kuhle lokho
kuyela laba critical
kuye umuntu obona ukuthi nje vele uthi ngeke mbamba ukuthi abe sesibedlela so lokho ngaba kuhla ukuthi to try to decongest even before you think of building up another hospital building up another facility sisebenzisa nje le mechanism to decongest kusehlise nombolo lesondele esibedlela kungena sidingo
kunalenye ke igroup la ezabeni ye-HIV kunalenye ke ngoba ema groups akhona even ehlukene ngifuna ukuthola ukuthi bona niyaba accommodate yini sinayo ama sex workers life sikeze kwathi nalisukumisa ihlelo lemetempilo laba ba very strong uadvocate ukuthi abathole amaphilisi ni treat kanjani lena
labo nawufika kaSnap nawufika eTikotembilo kaSnap we call this is our friends sibabeta ukuthi ama key populations such that kaSnap nje is one of our thematic area so ukuthi kaSnap nawufika ukhanza lobuke bantwana ukhanza lobuke labasala ngeHIV ukhanza lobuke bo BP nabo shukela ukhanza sibanye thematic leaders yabo kaSnap nje sinaye lobuke our key population where on daily basis we interact ukuthi how are they doing
Angikubambe dokotela, sifuna ukukhuluma nebantu labasha la inhlangano yabantu labasha bonkosi labaphila nayo iHIV. Ngithemba ukuthi sesinaye nje elayinini futhi shongwe asikuvusele sathwethu sikwamukele ehlelweni namhlanje sapha.
Ngiyabonga mfakazi ngivusele bonke nababukeli emakhaya.
Siteka indzaba la litiko letempilo limikisa ema services thutane nesive ikakhulukazi labo labadzingako ni bantu labasha leniphila nayo HIV even nasi siyatitola nje tibalo tethu la tiyasikhombisa ukuthi kule age group ya 15 to 49 27.4% baphila nayo HIV. Ingabe nilothabela kanganani lo hlelo lo lokuthi litiko letempilo lilethe lamaphilisi thutane nabo bantu labasha bangata uhamba mhlambe sigaba lesithi bayisibhedlela bayowafuna.
Ngiyabonga msakazi, ngingasho nje ukuthi sithanda kubonga yena uhulumende waseSwatini ekwenda siqiniseko nje ukuqala ukuthi emaphilisi sinawo lawa esibili saligciwane nokuthi asikade sabase ilinge lapho sakhanza khona ukuthi kwaba nelanga sekuthiwa mhlawumbe amaphilisi akaphelile asakhona ukwanaka. Sibonge nomsebenzi lo wenziwa nge-SNAP ngoba siqiniseko ukuthi abantu abaphila ne-HIV siyanakekeleka mhlawumbe ngasini ukuhlukana kwethu noma in terms of diversity yethu abantu abaphila ne-HIV. Njengabantu labatsha abaphila ne-HIV eSwatini, ngingasho ukuthi indaba yokusondezwa kwama-services kithi emimangweni siyayithokotela kakhulu. Siyaconda nokuthi uhulumende kusekuqala mhlawumbe asondeza ema-services kakhulu emaphilisi esindeza ligciwane kude kakhulu ngaphandle kokuba afike emtholampilo but kufika mhlawumbe ezinkundleni la sikhona khona. Mhlawumbe kungaba nje ngokuchushisa lokuthi umuntu lomusha udiverse nasingabeka mhlawumbe ngelimi lesingaba ngesilungu lokuthi as much as sithokota but akusithi sonke lesitawuvela mhlawumbe ngoba kunezingcinamba lesizipho lesisasenda ukuthi singakhoni ya emtholampilo. Siyalithokotela kakhulu lelihlelo efana nje siyacela lokuchubeka sibambisana nalesiko letempilo ukuthi bakhona bethu labathatha ukuchubeka bavele lemtholampilo labo bavele bawathatha khona ngesizathu mhlawumbe lesizipho emsakazekana ukuthi singakhoni ukufika le ema-communities noma lesinkundleni labafethela khona.
Sathwethu lingathini lakho ngoba siyamva dokotela advocate la uyayiveta indzabaye ukuthi lokhanza silabanye basengikadimukele ukuthi bayawanatha lamaphilisi batawusuka mhlambe enhlangano bafune ukuthi wathatha embabani lo yakhanza ukuthi mhlambe sekulimata nale indzabe ukuthi sisonzeta lama services thutana. Lingathini mhlambe lakho kucicutela nje ukuthi kusikhuthatha lo ukuthi umuntu asimukele simo le kakusi kakhulukazi enzabeni yayo nje HIV.
Mhlawumbe nje singasho lokuthi indaba yokutemukela nje ngendaba ye-HIV iqala kithi ukuthi wena loso testile namhla wakhanzakala unayo i-HIV singadisoli kakhulu ukuthi mhlawumbe kube angendanga nako mhlawumbe kuba ngendanga nako singayi-associate mhlawumbe nalomnye umuntu ukuthi uyathi ngithandana nabani ngicabanga ukuthi ngayithola kuyo ngoba lapho la kufike kube inkinga khona. Lokunye lokufike kushaye njengemimango mhlawumbe kuye kube nasikhathi la sikhuluma khona noma sithi siyadlala ema-jokes lakabi ngayo le-HIV lese enda ukuthi kube likhulu ukuthi ngingahamba lamangweni into walanza khona lamaphilisi ngoba lama-jokes la endiwe lamangweni akhombise lokuthi vele le-stigma solo sisetulu so bese ngikhanza ukuthi angeke ngikhone lokuthi ngingakhuluma nalokuthi kuphila le-HIV noma kumukela ukuthi sonayo kuyi-process kufuna lokuthi sikwemukele lokho because sinela Swatini yathi ukuthi sinebantu labasibukile lamangweni noma nasesibhedlela amawufile napha sobika singama-expert clients. So it's a process lebazama kuyenda ngaso sonke isikhathi ukuthi sigcine semukele but asifanani sibantu nema-backgrounds ethu la siqhamuka khona akafanani nekokuthi-ke iseseyenze lendima lemele siyidlale loko saqala ukuthi besempilo basibekephelele ngoba nathi siyadlala le ndima yokuthi vele asigcinele amaphilisi umuntu awathatha la ahlala khona ngokuthi kwenda nalokuthi lokulwa nale stigma kube lula kakhulu uma wathatha la ndaweni kuvele nje sekuyinto lesayelekile. Mhlawumbe kungaba kusho lokuthi usesemude lo mgamle kumele siwudlale kepha siyabona khona lokuthi leli zinga lokubadlulana seliya ngekwehla kepha nje siyalimukela kakhulu lehlelo njengabantu labasha labaphila nayo HIV but-ke besingacela lokuthi imalida alibe comprehensive thina nje sibantu labasha sibukela indaba double sexual reproductive health sifuna ukuthi konke kungaqhamuki kulamaphilisi kuphela but akute futhi kube youth friendly ngoba utawufika le emangweni singeke thina njengabantu labasha because lendlela lokuqhamuka ngayo iva ngazi ukuthi le ndzawo is not safe for us and ayikho friendly for us. Maybe kungaba kuleyo challenge kwanyalo besingabhekana nalokuthi nje asibeni involved sivakale lokuthi sifune sifisana kukwendeke kanjani nalokuthi umuntu lomusha very liquid namhla ke khona mhlawumbe kutawubonakala labantu abadala ngibona ngazi sibasonzela lethi ngune thina sikho because siyathi ukuthi sizama impilo lena le so vele ngitawuya la ngikava ngathi kubhute khona ngaleso sikhathi kini mhlawumbe la ngikubambe khona ematoko noma ngivule leyo business ana yami bese umuntu lomshado afuna sim-understand vele lokuthi angeke nje sithi vele utawukude bakhona laba atawuvela but nakhona aqhamuka opportunity so tawushiya aye kuleni ndawo kuloko litiko letempilo saqala sithi understand ukuthi vele umuntu lomsha akafanani nomuntu omdala.
Bonga kakhulu sasewethu ukuthi ube nathi namhla ehlelweni. Dokotela, she's touching on a very important point.
Yes.
Le yalabamfu labasha youth friendly services. Ngibona lokubaqoshaka emtholampilo. Ni addressa kanjani ukuthi bakhona vele kuba free ukuthi akuthola ama services enwaketha.
Ngiyathokoza ngalombuto lo bhuti wami. Lokumnanzi ukuthi kubekisa mhlawumbe ngabe kumuntu ku spotlight. La nasisebenza setiko letempilo. Sinabo labo partner noma mhlawumbe sinabo lama implementing partners. That go even beyond kuba setenkundleni ngoba kusele nje kulohlango lwesindwa ngisisi sina FHI 360. FHI 360 is strongly concentrated in zabene ukuthi bantu labasha labane HIV noma ngayiphi indlela fire customer keep ups ukuthi ama services abo how are they integrated excellent kwethu so sinabo in the round table kulomsebenzi wokudistribute amaphilisi abangweni. So they normally give a very good comprehensive balance nas discuss nje ngoba kusangale emhlanganisi banawo lesibini bavele nabo baqhamuka base okay sisebenza kahle manje ndakufuna sikulungisela na to say they've got their own advocate inside the round table of planning this kind of a move. So basi Johnson Ndlebe nase kwangathi we getting security to all people but Johnson Ndlebe ukuthi ekhumbulana nana lenguthanzile sisidakhulumisile nzaba ye comprehensiveness ukuthi le package ifuna ibe njani vele letinto ngibalela ukufisha nyana lo bakhona la uma condom kukhona konke ukuthi as you go to them nekuthi ke futhi kuletinzawo dabo nangubekisela nje ma key pops anetinzawo tawo la khanzakala khona ukuthi they have their moment interact amongst themselves and get the services lapho abakacoshwa ukuthi ngoba sikusilwa na COVID hlala nemakhaya njani nabo we do have the allowance ukuthi kuloyo nalo lovangathi something is pressing. It could be pressing socially or even pressing medically akafele la tinzawo entabo la sibonana nabo khona awuthola sitolo we trying as hard as possible ukuthi this become an easier and a friendly exercise ukuthi singagongi bantu and siyathi kuse the back noma from the background lokuwayo lapho kulolhambo lwethu kuwele sibedlela nakhona lokubonasa ukuthi akatholi kahle noma kukashoda short esibedlela nakalo kuvele bakhona labangazange sabasusa complete esibedlela ubona ngitakhuluma kahle nje khona singazange sabasusa all together bazala banemkhuhlane asibasusa ngoba ekselena ngaka HIV ka HIV isikhulumisa ukuthi umuntu wakhona nasomcalisa kulohlelo losiya we've got a checklist sifuna sijabulela kakhulu umuntu locinzedele i-viral load yakhe lo possible undetected sifuna nje ukuthi undetected kukhona lokhanza ukuthi they had what we call advanced HIV disease sho ukuthi bane nemkhuhlane lo lobonasa ukuthi subita advanced HIV disease banabo meningitis banabo TB njalo njalo ukhaza labo asikaba questions because we still monitoring them very close yebo asifuna ukuthi naka ekhanya mala nyale timbili tinzathu konakala ngala khona sihamba naye ebusuku nemini kodwa lelinyenti labantu questions sendele ukuthi at least we concentrate to those who come to the hospital easily and effectively.
Ukuthi bekungidokotela advocate Lamini sitekala uhlelo lwetiko letempilo lekusonzeta emaphilisi kakhulu kati emaswati lo khanza ukuthi aphethwe different but bita ngesilumbe bathi ngema chronic illnesses kuthi luhamba kanjani sithemba ukuthi iyaqhubeka kahle bongosi nemaswati aluthabele dokotela sibona kakhulu ukuthi ube nasinamhla sithemba ukuthi saphinde sinihlole nangamhlomunye sibe usihlelo luhamba kanjani
bosiyami angibonge Dumise emsakadweni ngokuthi nisibite sithi siyathokoza kakhulu kwedlulisa nje lwadi Silverty 7 siyacela siphinde nisibite ngosiyami siyasebenta lutshintsho lungavela noma kunini
ngokuthi sinifisela ukubukela lokuhle nakulethi inhlelo letiyolenzela kumsakado iEswatini TV sibonane ngalokudako lomsala wethu suku akasigcine siphephile bongosi
siyabonga.